Local hospitals, clinics, and the health department are getting calls around the clock from people worried about how to stay safe or what to do if they think they might have the virus. Investigative reporter Jeff Van Sant joins us live from CHI Bergen Mercy with what to do if you've been exposed. Jeff.
So the most important thing that you really need to keep in mind right now is to just not freak out. A lot of times for the majority of us, it's merely just a headache or a sore throat or even a slight cough.
Misconceptions, fears of the unknown. That's the problem right now.
Once we start learning more, I think the anxiety will kind of come down.
Dr. V with CHI Health is an expert in infectious diseases.
Over 80% of the adults who get the infection have very mild symptoms, just like any other viral infection. So, a cough or a fever.
Seniors or people with chronic illnesses are most at risk, but the defense remains. A thorough hand washing, not just a quick rinse. Dr. V says maybe sing happy birthday to yourself twice before walking away from the sink. Fears are growing here in Nebraska.
It was December 31st when this disease was isolated and identified, so we have just over 2 months of information on it at this point, and we're learning more every day.
The Douglas County Health Department says it's prepared for this scenario. They're now retracing the steps of the infected.
Contact tracing is something we do all the time. You may remember earlier this year and late last year we were working with a blackberry contamination outbreak. That was contact tracing. We're doing the same type of thing now.
Now, if you do feel like you might have the virus, the best thing you can do is either call your emergency room or a doctor and ask them what to do next, but never just show up. You have to make sure that they have some kind of preparations in place. But for the most part, as I said before, the majority of us, you can just sit at home and nurse it like you would a cold.